Good morning. Welcome to this Oncology Data Advisor interview. Today we're having this discussion from the 2025 Oncology Nursing Society Congress, and I'm joined by Dr. Zack, who is an oncology nurse at Rush University Medical Center and a clinical assistant professor at Loyola University School of Nursing. Dr. Zack is presenting a poster at ONS focused on testicular cancer education, and today he's here to tell us some more about this work as well as some insights for Testicular Cancer Awareness Month in April. Dr. Zack, thanks very much for coming on the show today.
All right, thank you for having me.
Absolutely. To start off, would you like to introduce yourself and share a little bit about what you do?
Sure. So as you mentioned, I am a staff and charge nurse at Rush University Medical Center. I've been there for 28 years now. That was actually one of my first jobs as a, finishing nursing school. And it's unique that I still exist in that role. But it's given me opportunities to mentor all the new nurses that come in. The hematology population is very complex, and that's usually been my expertise. Um, I received numerous graduate degrees, and again, the focus has always been oncology. My mom died when I was 20 years old, and that changed the course of my life. Of course, made me very passionate about oncology, and I haven't looked back. Although my specialties have changed a little bit within oncology, breast cancer initially, hematology for the last 28 years. I did spend some time with testicular cancer as well. Um, and it was during graduate school that I was paired up with a mentor, Mickey Goodman, who worked at Rush University Medical Center. And she was actually a guru, oncology nurse guru, and she published a lot of work. And she was actually the editor of Cancer Nursing at the time, which is how I got into testicular cancer.
Awesome. That's amazing to hear about. Thanks for the introduction. So looking forward to hearing more today about this poster that you're presenting at ONS next week. So to start off, would you like to give us a little bit of background about, first of all, about testicular cancer and why early detection is important?
Sure, sure. So testicular cancer is a rare disease. It's only accounts for about 1% of all male cancers in the United States, about 5% of urologic cancers, prostate being the most common, of course. But what's unique about testicular cancer is it strikes usually a very healthy individual. And again, it can start at, right after puberty from age 15 up to age 30, 45. And then there's a second incidence rate in the 60s. Um, But again, what's unique about testicular cancer is it's actually a very highly curable cancer. So it's unique in that it's a model for other cancers with this paradigm of early detection and prompt treatment. With the 95% 5-year cure rate, the problem though is there's people still dying of the disease. It's not perfect. So this year, 10,000 individuals will be diagnosed with testicular cancer, 500 will die. And again, it's the deaths that really strike me because this is a fixable disease if it's caught early. And those who do die, unfortunately, die because of pride. They're afraid to speak up when something changes in their body. So it really comes down to getting into the system, and many students, many young men are afraid to even say something. In terms of cancer, again, can cure some cancers. We can't prevent cancers, right? So again, even when you do primary and secondary prevention, primary prevention is trying to live healthy lifestyles, avoid carcinogenic substances. Um, but again, that still doesn't mean you will never get cancer. With secondary prevention, it's all about screening, trying to identify disease before they're symptomatic. And again, there's definitely a role for that, but the reality is for the best prognosis, the best outcome, when you have cancer, it's the current model that we have, which is early identification, early detection, correct diagnosis, and then prompt and effective treatment. And that way, and if we can catch testicular cancer in the earlier stages when it's confined to the organ itself, the testicle itself, local disease, then the outcomes are just so much better versus waiting till stage 4 when it's metastatic, and then it's just much more difficult to control. That's where I see these patients right now because I work in a hematology or hematopoietic stem cell transplant unit, a bone marrow transplant unit. We do autologous bone marrow transplants for testicular cancer or germ cell cancer. And again, our intent is to save their life, and sometimes we're successful, sometimes we're not.
Thanks so much for explaining why early detection is so crucial here. I'm sure a lot of it's like the awareness of signs and symptoms so that men know when something's wrong and why they should go to the doctor to get it checked. So, what are some of the gaps in kind of awareness and public education around testicular cancer?
Sure. So again, most students get their information from their health education class. And again, if I recall my education properly in high school, like 10th grade or whatever, um, limited to like a paragraph or two. And again, that's really not impactful. Passive learning versus active learning. And again, you don't remember any of that stuff. And so when you need it, it's not, that information is not there. And then everyone's support system's different. Um, who you have to help to bring concerns to. Back in 2004, the U.S. Preventative Services Task Force actually gave a D recommendation for testicular cancer. Now, again, they have limited resources, and again, they put all their resources and attention into the more common malignancies like lung cancer and breast cancer and colorectal cancer. So they actually did a D recommendation for testicular cancer, which means we do not routinely screen asymptomatic individuals in the population for this disease. Again, given its rarity and given its higher cure rate. Um, but as such, again, cryptorchidism, undescended testes, is going to get probably your largest risk factor for developing testicular cancer in your life. And again, during your first year of uh, being alive, again, the pediatrician, we're assessing for those undescended testicles and then intervening if that's not the case. Once everything goes down, then it's really checking the young man for hernias and things like that. But then usually it's lost. And again, once the pediatrician lets go of that individual, and then rarely do you see high school men going to a physician for care unless it's for their physical for sports. Um, but because of that recommendation, there's all the screening stopped. Okay, and it's just depending on if the physician assesses for nodules and educates the individual. And again, this is one of those things that falls through the cracks, unfortunately.
Yeah, definitely a huge gap there. So looking forward to hearing about the approach you took to addressing this in this educational initiative that you spearheaded. So like, tell us some more about it. What did the partnership and the program include?
All right, so going back to when I was in graduate school, again, paired up with my mentor. She was the editor for that Cancer Nursing Practice and Principles. Again, the premier college textbook to educate advanced practice nurses about cancer. And again, at that point, she was looking for someone to write her chapter on testicular cancer because no one was available to do it. So she asked me as one of her students. And again, I've never published like that or written for a college textbook. And that's where I really learned about testicular cancer. And she again fostered that pathway to publication. And then she paired me up with a local community group, Hadassah. So Hadassah is an international Jewish women's health advocacy group, and they are set up all over the United States and the world, so to speak, and also in Chicago. And again, here they already developed a program called Check It Out. Check It Out was originated in 1998. And again, it's a health education awareness program for young men for testicular cancer and young women for breast cancer. And they would go to the local high schools, pair up with the health education programs, and then do a small group education and awareness campaign, which was much more effective, engaging, and it would be paired up with myself as a healthcare provider, expert, really giving the medical information component of it, but also testicular cancer survivor, or for the women, a breast cancer survivor. So again, the hear their personal experience, offer their stories, provide that hope, and be able to answer direct questions that you couldn't just answer, ask a health education teacher or read from a book, right? So again, very engaging and very powerful. Now, and again, we would go down the list of all the different information about testicular cancer, um, from signs and symptoms, the risk factors, the treatment, all that stuff, side effects and survivorship issues. And again, it was giving them the information that they needed in that environment. And then the more important aspect was the survivor again sharing their story, because again, young men we think we're invincible, right? We don't attribute consequences to things. And again, the reality is they don't have control. And again, these diseases can occur and it's not their fault. And again, what to do when that situation happens. Because again, cancer is scary for everybody.
Absolutely. No, that's really great that it included both the healthcare provider voice and the survivor voice. I'm sure having the survivor there helped to put a face to it and show them that it's scary, but like there is a future after it, like if it does happen to you. So, yeah.
The other thing too is we would go, normally the healthcare expert would be a physician. I'm a nurse, of course. So they they prefer physicians, but again, physicians have office hours and they make a lot of money. And again, volunteering at different schools, because we would do like 20 schools a year, they're just not available. So I was like a substitute, I guess, for those 4 years. And I think I filled that gap and was able to connect better with the students again, because a lot of physicians, and nothing against physicians, but using the medical jargon, you palpate your left testicle of a 3.4 nodule, but you got to use their real words, real terms. Unfortunately, balls, nuts, family jewels, again, you got to meet them at their emotional maturity level, right? And there's times for jokes and there's times for serious. And again, once we made that connection, usually by saying a joke, breaking the ice. My favorite would be, we get 30 young men in a room. They would introduce me. I would always go first before the survivor would talk. And again, I would introduce myself and then pull out latex gloves, put them on, and look at them and say, all right, who's first? And again, just to see the terror in their eyes. But then, once they realized it was a joke and we're not doing this out in the open, um, they calmed down and they were able to take in the information.
Definitely, yeah, just break the ice a little bit and make them more receptive to hearing about it.
Yeah.
So, how did the students, like the presentations? How they respond to the education?
Yeah, no, they were very open to it. Now, again, it's taboo to talk about your testicles, all right? So that was a big hurdle to jump over. But once we started engaging them and giving them information, and there is a graphic nature to the content, when we talk about what cancer is and what happens in the testicle, and part of the surgery, the local surgery would be orchiectomy. Again, that's disturbing to some young men. And again, there were times where individuals couldn't handle that information, and we would always have a nurse other than myself be there to help address that when that happened. But we were trying to be very cautious with that, but be real with the information. Um, and again, like when it came down to them talking to the survivor, again, they had an orchiectomy. So again, it'd be questions that you can never ask, like, that, are you normal with only one testicle? Are you able to have a family, create a family? Are you able to have a career and all that stuff? I mean, so they just see the realization of the disease, and again, kind of a bump in the road if we can catch it early. Okay. Um, Most students, again, we did evaluations for them to see how they appreciated the program and if they would change any of their behaviors. And again, we just saw a major shift in self-care, self-awareness, knowing their body. Again, when you partner with the patient, or in this case, the young men, they know their body better than anybody else. And so the subtle changes, usually they're the first ones to find it, just like a breast exam in the shower, so to speak. Then they present to the healthcare provider then to do the workup. So that's just so very important. And then just giving them knowledge is power, giving them some control, um, and something to remember, because again, when they leave high school, usually that information is gone. And again, with this program, I think we were able to make some of that information stick to them.
Absolutely. Yeah, no, that's amazing to hear about. So, congrats on like developing such a successful program. So,
Thank
do you
you.
have any future plans for it?
Well, at this time, I have two positions, so I don't volunteer like that as I used to. But if they sought me out, I would certainly help again. The program still exists. They still go to all the local high schools again, because freshman through senior year, again, they still go through all those different schools. And again, anecdotally, we were able to find when I volunteered for those 4 years, a few individuals did have nodules, were confirmed to have testicular cancer in the early stages, and then obviously sought treatment. And again, that's all I know about that, but um, that's more than the national average of incidents. So that's pretty amazing that a little program like this was able to help them.
Absolutely. No, that is amazing. Going on to more general question, do you have any advice for the healthcare team about how to like broach the topic of testicular cancer risks with their patients and how to provide a space for patients to voice their fears or anxiety?
Yeah, I think just the young men, you got to meet them where they're at again in their emotional maturity level. Um, be real, use their jargon, right? Um, they have different words than we do, like fire and lit and riz and all that stuff. So you got to know the jargon, talk to them in their own language. Um, Men respond to respect. So again, giving them that respect, teaching them responsibility, and again, just being yourself, being authentic, I think is really important. And again, the best strategy was like, what's in it for me? Again, trying to frame it that this is important for you as a developing young man to know and to not ignore if this happens. And again, to reach out to a trusted individual, whether it's their dad, an uncle, a relative, a coach, a teacher, their best friend. Again, someone who's trustworthy to bring those concerns to, and someone who will take them seriously and follow up with those concerns. That's just so very important for that to get that first step to ask for help. Okay. Because again, the people that I see didn't ask for help, and here we're trying to save their life with the bone marrow transplant, and we don't want to be in that situation. Okay. The earlier we catch the disease in an earlier stage, the local therapy is usually sufficient for a cure, and then we can avoid other treatments. Right now, what's unique about testicular cancer is it is radio sensitive and it's chemosensitive, so that's very unique when we do have metastatic disease, that the treatments work really, really well versus other metastatic diseases, not so much. Okay. So we're fortunate in that respect. The platinum drugs really made a difference there. Um, and I think what's important is, again, there's a time for funny and silly, and there's a time for seriousness. And I think we found a good balance between those. And they left that room being better prepared for life.
It's amazing. Awesome. So my last question for you as we wrap up today is, since April is Testicular Cancer Awareness Month, do you have any like take-home messages you'd like to share with the audience to raise awareness of testicular cancer?
Again, this is a rare disease. Many of these individuals are forgotten or ignored. So I think just focusing on, whenever there's cancer to anywhere, and when people are still dying from the disease, there's still a lot of work to be done. And again, I think Mother Teresa famously said, go find your own Calcutta. Again, people want to take her position, but she's like, the world is filled with a lot of opportunity. You can help out your fellow man, serve others, find your own niche. And again, I think this was my niche at that time. And again, there's other things and for other nurses, and there's probably more nurses doing more than I am. So um, again, just partner with community, knowing your resources available, what programs are out there. Um, and again, we work in the healthcare arena. Again, we see patients when they come to us with disease. But again, I think the better focus of attention should be trying to catch the diseases earlier or teach them about awareness. Again, that's always better to try to nick it in the bud before it gets to the problem that we see it traditionally.
Definitely. That's a great message to wrap up on. So thank you so much, Dr. Zack, for coming on today to tell us about this program and to help raise awareness of the importance of early detection. It's really wonderful to hear about the program and how well it worked. And best of luck at your presentation at ONS.
All right, thank you. Appreciate it.